Aloha mai kako. Welcome to the 16th installment of the Ke'o Center for Sustainable Island Food Systems Brown Bag Speaker Series. We want to mahalo all of our guests for joining today as we examine one of the most urgent challenges facing Hawaii, the intersection of climate change, food systems, and community health. This session is going to look closely at how rising heat, extreme weather, and ecosystem change are affecting food security, nutrition, and what strategies we can adopt for resilience, equity, and healthier futures. My name is Ioane, and on behalf of the center, I want to thank today's speaker and all of you for contributing to this important conversation. Please scan the QR code on the current slide to access our website for information and additional resources. And if you don't have time, don't worry, I'll also be posting a link to our website within the Zoom chat as we progress, including resources, articles, and the speaker contact. Also, I want to ask if folks could subscribe to our MailChimp to receive newsletters and follow us on Instagram at Ke'o Center for event updates. In addition, a recording will be sent out to all registered attendees following this session. A little bit about the Ke'o Center. This is an initiative within the University of Hawaii system, co-directed by Dr. Noah Lincoln and Dr. Albie Miles. And our overall mission here really is just to strengthen Hawaii's food systems through food security and justice, ecological sustainability, education, storytelling, policy, cross-sector collaboration, and community partnerships. This Brown Bag Speaker Series was created to bridge gaps, share stories from the field, and build alignment around Hawaii's most pressing food systems issues. We found that within our islands, food systems work is vibrant, but it's often fragmented. People are working in silos. So our long-term vision is to really understand how the UH system can best support food system transformation in service of the people and lands of Hawaii. In some of our broader work, the center also engages in applied research and data analysis, community education and events, and policy monitoring and advocacy. We feel by convening practitioners, policymakers, and educators, we're helping shape Hawaii's path towards greater food sovereignty and resilience. Today's topic and context, the title is Climate Change, Food Systems and Health, Understanding Vulnerabilities, Impacts, and Community Resilience. And in today's conversation, we're going to dive into some things like how climate stress affects food system vulnerabilities and nutrition security, how the public health risks tied to how public health risks are tied to food access and chronic disease, community resilience strategies that integrate indigenous knowledge and cultural practices, and pathways toward equitable adaptation and disaster readiness in Hawaii and the Pacific. Each section of today's discussion will be informed by current research and data on climate change impacts in the Pacific with examples from agriculture, fisheries, nutrition, and public health. We're very honored today to welcome Dr. Elizabeth Kiefer. She's the Assistant Clinical Professor of Medicine, the John A. Burns School of Medicine, UH Mānoa. Dr. Kiefer's work connects climate change, public health, and food systems with a focus on community health and resilience. So without delay, Dr. Kiefer, you could take it away.
Thank you very much. Let me just share my screen and get started here. Slideshow. Okay, does that look okay? Great, thank you. Wonderful, thank you so much for having me. It's a pleasure to be here. Let me just start with my own brief climate change story. So I had a climate change awakening in 2018 in August when Hurricane Lane threatened to hit the islands as a Category 4 storm with winds up to 150 miles an hour. And this really scared me, and it was my aha moment, because if I was scared and worried about my own health and the health and safety of my family, I realized that doing something about climate change could actually use the health lens to be a way to enact change. I completed a program on climate change and health at Yale and have been working in this area ever since, trying to bring that health message to climate change, especially because I learned that nurses and doctors can be trusted messengers when talking about climate change. Hurricane Lane thankfully did not hit Hawaii, but the year before, we saw what a Category 4 storm could do to an island. Hurricane Maria destroyed Puerto Rico, and people went without power in some areas for almost 1 year. This is a picture from Cyclone Harold. This is another Category 4 that hit Vanuatu, Fiji, and the Solomon Islands in 2020. And the theme that emerges from around the world is that, number one, people who contribute the least to climate change often suffer the most. And number two, climate change is a threat multiplier. So it makes existing problems worse, including societal problems, economic, food security issues, and health issues. And in our neighborhood, the Pacific Islands contribute less than 1/10 of the world's greenhouse gases. However, we know that these low-lying atolls and these nations at sea levels are at the forefront of climate change. And we know pretty clearly what climate change means for Hawaii and the world. Air temperatures going up, rain and stream flow have decreased. When we do get rain, the intensity of that rain has increased, sea level and surface temperatures have increased, and the ocean is acidifying. This is a graphic from the CDC showing how we like to think about climate change and how it affects health. Rising temperatures, rising seas, extreme weather, and increasing greenhouse gas levels contribute to environmental impacts like extreme heat, drought, environmental degradation, which then affect health in all of these buckets. And ringing all of this, the pink ring is mental health, which touches all of the areas. And once you start looking at climate change through the health lens, you see these connections everywhere. And once you start looking at climate change and health and food systems, you also see all of this connectedness. So it's important to have a baseline understanding of general health issues from climate change. So bear with me. We're going to for each bucket, we'll go broadly and then overlay food systems impacts, and you'll see how all of this interacts. All of you think about food systems every day, so you probably all know this already, but the availability, accessibility, stability, and utilization of food is worsened by climate change, which then worsens health in a number of ways, which we'll go through in detail. Here is just one example from a couple of years ago, June 2020, to illustrate all of this. Climate change warmed our atmosphere, and we know that the ocean absorbs nearly 90% of the excess heat, and the ocean becomes warmer. More moisture in the atmosphere and a warmer ocean means that cyclones are more intense, so you have higher category storms. And in East Africa, this storm cycle led to enough rainfall to cause lakes of water to form over farmland and dry areas. This in turn caused vegetation blooms, which led to favorable breeding conditions for locusts. And locusts eat their body weight in food each day. So they decimated maize, millet, beans, fruits, all kinds of crops. And that led to crop failure, which also impacted livestock feed. And this led to famine and malnutrition. By the way, this was during COVID, and we know that malnutrition actually contributes to immune dysfunction via changes in the cellular epithelial barrier. So again, just to point out, another area, Africa, bears an increasingly heavy burden from climate change, despite contributing a fraction of the world's greenhouse gas emissions. So this is just one example of these complex interactions. Let's dive into the health effects from extreme heat and related to heat, that would be drought, and how this all intersects with food systems. So we know it's getting hotter every year. We have historical records from NOAA, and it is projected to get hotter. So compared to a 1951 to 1980 baseline average, we see that temperatures worldwide have already increased about 2.3 degrees Fahrenheit on average. And these bands that you see, the red and the green one, are representative concentration pathways, and they model different futures. The red is the business as usual model, so we chug along, we don't do much to reduce our emissions, and we see by the end of 2100, we are at least 4 degrees or more hotter than the historical baseline, and that is very bad. The green band is in a more aggressive, lower emission scenario, and we still actually see that that band hovers around our new normal and likely goes a little bit higher. And that's because of thermal inertia. So we're committed to the greenhouse gases we have already emitted. It takes hundreds of years in the case of CO2 to dissipate, 8 to 12 to 20 years in the case of methane. So we are going to get warmer. When we think about heat and the human body, there's a lot of lay person terminology. You probably heard heat exhaustion, heat edema, heat stroke. And basically what we know is that heat illness is a spectrum. On the milder side of the spectrum, you have heat exhaustion. So that's dizziness, thirst, heavy sweating, nausea, weakness. We've all kind of experienced the heat to this degree. As you get more extreme, as the body heats up, it can be so hot that the vital organs shut down, and that can lead to heat stroke, which encompasses confusion, dizziness, passing out, and in the worst case scenario, organ failure and death. As you start to lose water and salt from sweat, and as the body's core temperature heats up, you start to lose blood volume, and we start to see hypoperfusion. That just means that less blood is going to the vital organs until the brain and the heart don't get oxygenated, and that causes death. But what I want to point out is that each stage of the spectrum of heat-related illness, people who suffer from chronic diseases such as diabetes, high blood pressure, heart failure, those conditions get worse because those diseases already have issues with managing fluid and electrolytes. And we know that there are vulnerable populations. Pregnant women, heat is associated with adverse birth outcomes. Babies and kids can't yet physiologically adapt like adults, so they're vulnerable. Elderly patients and those with chronic diseases, like I mentioned, these people get into trouble too. If you have diabetes or heart disease or kidney disease, you already have to be careful with your diet. Now you start to add in heat and food system impacts, which we'll talk about, and we again see how climate change is a threat multiplier. And of course, the medications that we prescribe routinely to our patients also cause vulnerability during the heat. So now that we understand what heat does to the body, we'll layer on the intersection between heat and food and health. Extreme heat affects food systems, which affects health through spoilage, lower crop yields, stressed livestock and fisheries, and decreased nutrient density. Our food safety will be affected by climate change. We all know this. When it's warm, food spoils because pathogens thrive. This is from a meta-analysis done last year, and the thickness of each of these lines is proportional to the number of studies relating climate change and specific food-borne pathogen proliferation. So you'll get increases, we expect increases in things like Salmonella, Campylobacter, E. coli, and parasites. And that's just from the warming portion. We'll talk about other mechanisms in a bit. Just for an example, Salmonella causes salmonellosis, which is a common foodborne illness, and it's found in contaminated foods, eggs, poultry, and meat, and it can have some adverse health outcomes. Going to another effect, we know that extreme heat decreases crop yields. That's no surprise here. We've all had plants wilt and suffer in the heat. But what I learned and what I didn't know was that from this recent paper is that you get the same molecular stressors that we see in humans, like oxidative stress and free radical formation, which are activated from heat. And this puts stress on a plant, and that actually makes the plant less productive. When we start to look at how less productive, we can actually do projections. So NASA has done a lot of this research. This is from one of their global projections, looking at maize, which is corn, maize yield projections. And as early as 2030, under a early high greenhouse gas scenario, and as late as 2095, we see varying degrees of decline in maize crop yields. So a more negative percent change is shown in red here. And maize is the third most consumed cereal crop in the world after wheat and rice. And it's the staple crop of more than 300 million Africans, especially in sub-Saharan Africa. It needs a lot of water to thrive. It needs regular watering at the right time and consistently. Most maize production in sub-Saharan Africa is rain-fed as opposed to irrigated. So climate change is actually wreaking havoc with these rainfall patterns, which can affect crop yields. Wheat also plays a central role in diets. Wheat alone provides over 20% of the world's calories and proteins, and to ensure food security for the predicted population increase of 9.6 billion people, total, by 2050, they've done modeling, studies have done modeling, which show that actually we have to increase by food production with wheat specifically by 60%, but modeling actually projects a 15% decline in wheat production, for example, in African countries. So with yields declining, the demand for the amount and the quality of food is increasing. And we can see all around the world that heat and drought and decreased crop yields are straining political systems. Recall that the Arab Spring was sparked in part by rising food prices. And you don't need to be a doctor to know that famine and hunger are bad for health around the world, and that climate change multiplies this threat. We know, and it seems obvious, but heat will affect livestock as well. I don't know specific cow physiology, but this graphic and what I learned and what makes sense shows that these animals reach a threshold where their adaptive mechanisms, like humans, to heat are exceeded, and that reduces their milk yields or even causes death. And we've seen this. This is not just theoretical. In 2020, there was a widely circulated video showing the fatal effects of heat stress on about 2,000 cattle, a big herd in Kansas. The humidity was very high, the wind was low, and the animals had not yet shed their winter coat, and that led to this massive die-off. So all animals, mammals, to a greater or lesser degree, are subject to similar temperature humidity limits like humans. Unlike humans, wildlife does not have access to technologies that we have to cool off. So the heat waves of the future are worrisome in devastating livestock yields if they don't kill the animals outright. We'll talk about this more, but obviously the health of these animals and their ability to survive and be healthy affects human health. We're also worried about the quantity and quality of fish catches, which notably are a huge concern as these fish seek cooler waters. So the hotter, warmer oceans are affecting the tuna supply, and this is affecting people in our Pacific Island neighborhood. You multiply this migration of tuna to different areas, you multiply that in with some of the geopolitical shenanigans from these larger nations who want to fish these stocks, and you can see how these smaller nations in our Pacific Island region will lose out. Remember that climate change is a threat multiplier. Diets were already shifting for many years due to patterns of colonization, socioeconomic changes, and globalization. Once you start to add in heat stressors to crops and fish and meat, and people turn away from traditional foods, you start to see shifts in diet. So we know that traditional foods protect health. When you move to a modern diet, we are concerned about obesity and non-communicable diseases, which proliferate when you have these changes to a modern diet. I will point out that both the traditional food system and the Western food systems are vulnerable to climate change. But again, traditional food systems are better for health. In our Pacific Island neighborhood, again, fresh food, root crops, fruits, the way that we cook in a traditional way, that's much better than the processed imported foods, which drive obesity, which then drive diabetes, heart failure, hypertension, and kidney disease. In fact, in the Pacific, obesity and non-communicable diseases are already a huge problem. There are some of the highest rates of obesity in the world in the Pacific. And remember that dietary risks contribute to a large portion of chronic diseases like diabetes. So this is from a study in 2022 looking at the prevalence of risk factors for chronic diseases like smoking, not exercising, and diet. All of those risk factors contributing to the death rate from diabetes in Pacific Island countries, and gray is the dietary risk factors. So you can see that diet actually plays a huge part. Given those statistics, it's no surprise again, that we have some of the highest prevalence of diabetes in the world here in the Pacific Islands. This is from the International Diabetes Federation, which does epidemiologic stats about type 2 diabetes around the world. Age is a major determinant of diabetes risk. So these are age standardized diabetes prevalence statistics and estimates and projections. And as you can see worldwide, the Pacific Island rankings in the top 10 for 2024 and the projections on the right for 2050 are very high for many nations who unfortunately made it into the top 10. Diabetes is the leading cause of kidney disease. And kidney disease can lead to renal failure and a lifetime of costly morbidity and mortality associated with dialysis. Thinking about some of these things, putting this all together. So as there's a shift in diet, as there's these other factors that have pre-existed, some of that socioeconomic change, things like that. But as fisheries shrink due to some of this heat, as coral reefs bleach due to heat, there's less fishing, there's less cultural practices of fishing off the reef, which again contributes to eating more canned and processed foods. And that can lead to, as we've seen, some of the obesity-related diseases like diabetes and cardiovascular disease. I thought it was really interesting looking at dialysis as a marker of disease. In 2008, the first dialysis center opened in Fiji. And if you think about the cost and the people power and all of the stuff that goes into running dialysis, it's amazing to me that by 2022, 6 more dialysis centers opened in Fiji to meet the demand of that high disease burden that is afflicting Fiji today. Extreme heat contributes to this double burden of disease. So extreme heat contributes to decreased nutrient density. If you already have obesity, obesity plus malnutrition means that you are not nourished with these essential nutrients, which we'll talk about, but you also have obesity, which leads to these other diseases. So heat causes crops to grow faster and they dry out quicker or they're exposed to more carbon dioxide. So they have less time to accumulate the protein and the vital nutrients. So protein goes down. As you have reduced photosynthesis and lower protein levels, iron goes down. As the soil dries out, you have weaker nutrient uptake in general. So you see a decrease in zinc and B vitamins. So our food starts to have less of the good stuff. And we see this link between heat and decreased nutrient density. Micronutrient deficiencies in turn have consequences throughout the life cycle of humans, from low birth weight in babies to stunted growth in children, decreased brain development, to impacts on chronic diseases in adulthood, to higher death rates in older adults. So micronutrient deficiencies are important, and they've actually been called a hidden hunger for this reason. And this is just one example of how micronutrients affect one of these diseases like heart disease. So the heart needs these elements of zinc and selenium and calcium and vitamin D to fight inflammation and bad cholesterol, and all of those things can lead to heart attacks and strokes. Shifting gears to talk about another effect of heat, we also know that heat causes price spikes. Bananas are actually very sensitive to temperature rises, and those temperature rises and some of the diseases that they can have cause banana prices to go up. So one of the biggest concerns with heat is a fungus called Fusarium wilt TR4, which has moved from Australia and Asia to Africa and now to South America. And once a plantation is infected, it kills all the banana trees, and experts say it's extremely hard to get rid of. And so as we see prices go up, we are concerned about price increases and health. So as prices go up in bananas or eggs, for example, as people become more price sensitive, we start to see that people need more assistance buying food. And one of the things we know is that when we have assistance, like SNAP, which is the Supplemental Nutrition Assistance Program, to help us with food, help people in our society with food insecurity, when you cut those benefits, you see increases in food insecurity and you see increases in poor health. And we know this because during COVID, there were emergency allotments to SNAP, which were granted. When SNAP ended in 2023, you can see there's this vertical line. This is from JAMA. You can see that SNAP participants actually reported more food insecurity and more reported poor physical health days compared to SNAP eligible controls. I'm sorry, those are the people that lost SNAP. So again, we know this from our COVID days that food insecurity more than doubled, and that SNAP was very beneficial to health, and that cutting that led to more poor health outcomes. Okay, this is a very busy graphic, but putting this all together. So I normally use this graphic without all the blue arrows to illustrate how complex the human body is and how this complexity in this system adapts to heat via the kidney and the heart. And this is just what happens to a healthy person. So we know that dehydration taxes the kidneys, and the heart muscles and the vascular system are under enormous strain as the body heats up, and even healthy people get into trouble. When you have chronic diseases or pregnancy or you're a child, the balance of water and salt is much less resilient. And we see this actually all the time in the hospital. Sometimes a single high sodium meal is enough to trigger an acute heart failure exacerbation or an acute on chronic renal exacerbation. So if you are a vulnerable elderly patient with pre-existing diabetes or heart failure, and you're sitting in your house in a heat wave, and now you add in some of these food consequences. We have concerns about foodborne illnesses contributing to dehydration, price increases, or maybe they've cut SNAP, leading to the purchase of less nutritious food, or the food that you're eating already is less nutritious because of low crop yields and micronutrient deficiency. And you turn to salty, cheaper food that has fluid and salt, and all of these shifts then contribute to changes in your already pre-existing issues with heart and the kidney and vascular system. It just means that there are real acute physiological consequences in the human body that are overlaid with heat and food systems. So that was a lot. What can we do? You all in this audience think about food system solutions all of the time. So I have just highlighted the things that I think can be most impactful on health when strengthening these systems from the physician perspective that makes sense to me. So that means promoting climate resilient, indigenous, nutrient-rich crops, using renewable powered refrigeration and resilient transport to reduce that food spoilage and foodborne illness, addressing nutrient losses, strengthening and expanding SNAP, and tracking impacts of climate and nutrient content in foods. Also with community resilience, and again, incorporating indigenous food knowledge and traditional diets, incorporating things like community fridges to have accessible food. And I know that this group is very involved, and it gives me a lot of hope to see all of you working in this space to make these kinds of impacts. Okay, phew, that was just heat. So let's move on to see two different buckets. What happens with climate change, severe weather effects, which go along with water quality, and then overlay food systems. So severe weather includes flooding, drought, and wildfires. We already talked about drought. When I first gave this talk, I focused mainly on storms and floods. Lahaina hadn't happened yet, but obviously that's changed everything. When you talk about climate change and extreme weather, rather than saying, does climate change cause extreme weather? The more important question to ask is, are extreme events occurring more frequently with climate change? Because individual events can never 100% attributed. And then the other thing to ask is, how much more likely was an extreme event to occur in the presence or absence of climate change? And we talked about this before, but we know with warmer water temperature, there's more moisture, there's more fuel for storms, and this increases the potential for tropical cyclones and hurricanes to bring heavier rain and higher storm surge. In Hawaii, the current thought and prediction is that storm intensity will likely increase, so higher category storms, but the storm frequency potentially will either decrease or remain unchanged. So the current hurricane season this year is expected to be near normal to possibly below average in activity. And we already just had several storms pass us by. When you have a hurricane or a fire, we know that health suffers. So this is Hurricane Maria, again, a picture from Puerto Rico in 2017. So if you've survived the storm, you think about the things that affect health. How are you going to get to the emergency room in this environment if the ER still exists, if you're injured during the storm, or if you have a heart attack when you're trying to clean out the remains of your house, or you run out of insulin because you can't refrigerate it and there's no power. So all of these things affect health. And when people have gone back and looked and studied these major storms, the health effects of a severe weather event can cause deaths that are immediate and delayed due to all of those issues with infrastructure and displacement. Again, people with chronic disease fare worse in climate change related events. So this is a study from New England Journal looking at some of the mortality data. Here you have the average age of death in Puerto Rico in 2016, 1 year before the storm, hovers around about 80 years old. And then here's the storm, Hurricane Maria in September. And then you can see these different colored dots are deaths directly related to the hurricane and indirectly related to the hurricane. These are these yellow triangles. Suicides are in purple, and then other deaths are in gray. And basically what you see is that, acutely there are these deaths directly related to the hurricane, but indirect and direct deaths continue months after the storm. And they actually have a much higher age spread about the previous mean. And so again, it just indicates that the storm actually has lasting effects well beyond the initial event. And this chart from the same study just shows that a large percentage of households were unable to get medicine, unable to plug in and use respiration equipment, unable to get to the doctor because the roads were damaged. And this was a very impactful study because it was very illustrative of how a devastating high intensity hurricane can be to the health of an island population. Infections are a big cause of indirect morbidity and mortality. When you are wading through that flood water, if you have a diabetic foot ulcer, for example, and you're wading through this contaminated runoff and sediment and debris and waste that harbors both human and animal fecal coliforms and enteropathogens, you're bound to get in trouble. And we know this. We saw reported increases in various pathogens after major storms. So we saw increases in the case of bacteria found after Hurricane Katrina, increased cases of Vibrio vulnificus after Hurricane Ian in 2022, and we actually also saw increases in West Nile after Hurricane Katrina in Louisiana and Mississippi. We'll talk a little bit about vector-borne diseases a little bit later. Now, when you layer on food systems on climate-induced extreme weather effects, we see, no surprise, that there's a destruction of harvests, a destruction of ports, food storage, fishery and fisheries, volatility, food spike increases, and reduced access to healthy food. And all of that leads to poor health. One more bit about microbes and pathogens. So hurricanes bring microbes into contact with plants that would otherwise not be exposed to them. And so you can have crop spoilage from contaminated soil, like this fungal blight that hit upstate New York after Hurricane Irene. In 2004, Hurricane Ivan, for the first time, brought this fungal infection to hit the South and spread pathogens in the soybean crops. And that actually decimated the soybean production that year. Many of you in the audience probably worked on this grant with SOEST looking at our food security, but we all know that we have less than 2 weeks of food on the islands, and obviously that can affect our health. This photo shows how Cyclone Pam in 2015 wiped out the majority of crops in Vanuatu. And if you think about it, don't forget that when a cyclone hits and your agriculture is destroyed, the reliance on imported food aid can compound the problem, especially with aid. So we send shelf-stable processed foods to people all around the world suffering natural disasters. And so when these disasters strike, healthy diets are among the casualties, and it can take anywhere between 6 months or a year to get those crops back, like in Vanuatu. So that's 6 to 12 months of eating these processed foods. And we saw back in the heat slides what can happen when you rely on modern imported salty, terrible diets. So what can we do? From a health standpoint, again, changing stockpiles to shelf-stable, nutrient-dense, culturally appropriate food would be wonderful. And I know many of you are working on these issues. Again, strengthening, expanding SNAP here in our own country. Some of these things can really help. And when we talk about shelf-stable, nutrient-dense foods, we can talk about things like canned and dried beans, lentils, whole grains like oats, brown rice and quinoa, nuts and seeds, dried fruit, and then low sodium canned vegetables, which are much likely to affect our patients with diabetes and cardiovascular disease. When we talk about climate change and extreme weather, we are also talking about flooding in our Pacific Island nation and also degraded living conditions and environmental degradation. These can lead to mental health issues. This can lead to migration, and degraded living conditions also impact some of the social determinants of health. So we'll overlay this again with food systems. So about 97% of the population of the Pacific Islands is vulnerable to sea level rise because people live in proximity to the coast. So this is a study from 2019 in PLAS 1, and all those yellow bubbles are people living less than 1 kilometer from the coastline. So you can see the majority live very close. And sea level rise doesn't occur uniformly around the world. A combination of global and local conditions, such as coastline topography and the influence of glacial meltwater, how that's distributed in the ocean, affects the amount of rise for a particular region. So worldwide, since 1993, seas have risen about 9 centimeters. So that's about 3.3 millimeters per year. In the Western Pacific, the seas have risen on average about 10 to 15 centimeters, or 4.5 millimeters per year annually since 1993. In Hawaii, some of our highest tides are king tides, and these are naturally occurring. But when you overlay climate change, again, as a threat multiplier, we see and we've seen that some of our king tides now inundate roads. This is just a picture from Waikiki. So again, climate change is a threat multiplier of this naturally occurring high tide. Back to our Pacific Island nation, in Tuvalu, 500 miles north of Fiji, the nation is composed of 9 atolls, and 10,000 people live there. Now their king tides have gotten so progressively more intense that they actually sweep ocean across the island, and they more frequently flood the airstrip and people's homes, and as we'll see, crops. Again, one of the things that we worry about is soil and freshwater salination, which reduce crop productivity, and then community displacement. That leads to poor health through widening inequity and chronic disease. So this is just a picture of a dying taro garden in the Solomon Islands in a local news article talking about saltwater inundation, and some quotes from local chiefs talking about how that has destroyed taro crops and even fresh water. And we know, just like we went through the heat and the drought example, that food shortages and a swap from traditional diets leads to poor health. So as the tides flood your house or the salt water kills your taro crop and inundates your freshwater wells, people are starting to wonder, do they stay or do they go? And certain Pacific Islanders can move and work in Hawaii very easily. Agreements in place after World War II to help nations recover from the war. The most recent one would be COFA. I'm sure you're all aware of the Compact of Free Association. But basically it says that residents from these nations have the right to live and work in the US without immigration restrictions. And there's about 20,000 migrants who have chosen to leave Palau, Micronesia, and the Marshall Islands and come to Hawaii. This is a Micronesian family in a shelter in Hawaii, and they were profiled in a homelessness and climate change article a few years ago. So people are here already, and they're facing stigma, health challenges, mental health issues, as people leave their home islands because their livelihood is at risk. And so you have to ask, do we have the health infrastructure to care for these people? Is the infrastructure available to provide food and food security to these additional climate migrants? I'll add in another layer. So this is the Runit Dome, and it houses nuclear waste from the nuclear bomb experiments that the United States did in the 50s. So you'll recall how the US bombed Bikini Atoll in the Marshall Islands and sickened thousands of people with radiation exposure. Because the 377-foot wide crater was never lined, there's now evidence that radioactive contaminants are leaching through the coral rock. And as sea level rise occurs in these areas, it's lifting and cracking the top of the dome. And people are very concerned about the structural integrity of that dome. So adding that already to some of the contaminated water levels, you have real concern about another layer and another threat, and more climate migration. So as I mentioned, there's 20,000 plus Micronesians living in Hawaii, paying taxes in the country legally, eligible for SNAP since 2024. There was a period from 1996 to 2024 when the federal SNAP benefits were taken away, but our state stepped in to help in many ways. So when you look at these people from Micronesia or these Kofanesias that are migrating because of climate issues, because of safety issues, they actually have huge health disparities, especially when you compare them to other ethnicities in Hawaii. This is a study that was done a couple of years ago. So is our health system prepared to take care of these younger yet sicker migrants? And do we have the systems in place to feed this most vulnerable population? So again, climate change is a threat multiplier. Chronic diseases, migration issues from environmental displacement and food security all can be compounded by climate change. So what can we do to deal with some of these health effects from environmental degradation, societal inequities, and migration from the food security and the health lens? Again, going back to some of our the things that we keep saying. So embed nutritional resilience into climate adaptation policies, start to train clinicians to screen for food insecurity, connect our most vulnerable patients to resources, and again, strengthen and expand those food security programs that are in place for our most vulnerable populations. I'm going to switch gears to vector-borne diseases. So in our neck of the woods, this means mosquito-borne illnesses, but for the continental US, for the mainland, that actually means tick-borne diseases. And I will explain how all this is related to food in a bit. But briefly, just for a quick background, in Hawaii, we have the mosquito that carries major mosquito-borne diseases. So we have Aedes aegypti and we have Aedes albopicus. Aedes aegypti is on the Big Island, but Aedes albopicus is on all islands. So these specific mosquitoes have the potential to transmit dengue, yellow fever, chikungunya, and Zika. And remember that these mosquitoes love breeding in containers of standing water. So we're not endemic here in Hawaii. So that means that the diseases do not currently circulate, but we occasionally have large outbreaks related to travel because we have the vector. And just these are some of the signs and symptoms of dengue. And just to point out, there's no cure for dengue. It's only supportive therapy. When you talk about climate change, when you talk about increases in temperature and you talk about increases in rain, these favor the survival of mosquito larvae. They favor a faster life cycle. And with warming temperatures in place, mosquitoes can live in areas that they previously could not survive. So this is a study looking at looking at a projection. So the top is a 1990 baseline. These are the populations at risk for dengue. And then when you start to project what happens as you have a warming world and mosquitoes start to move to cooler places, you show that really much more of the population becomes at risk for dengue because of these temperature increases. We don't have tick-borne diseases here in Hawaii, but you're going to see the same patterns of epidemiology on the mainland with tick-borne diseases. So briefly, ticks are born in the summer. They have their first feed on a small rodent or a deer. Those animals get infected with the Borrelia bacteria, that's for Lyme, but there are a number of tick-borne diseases that are carried by these ticks. The ticks become infected and then eventually go on to bite and infect humans. Lyme disease and a lot of these diseases in general cause rashes, fever, terrible joint pains, and as they progress and may not be treated, they have neurologic and cardiac complications. So again, what we see from the mosquitoes, we see in Lyme disease and tick-borne diseases. So as you have increasing temperature, these ticks survive longer and they start to go north to cooler places where they previously couldn't live. And there's really grave concern about the expansion of diseases like Lyme disease, especially in communities that may have not seen these diseases before and not recognize the rash or some of the other complications. So this is just a comparison of cases from 1996 along the eastern seaboard to 2018. And you can see that the disease has a larger, more northern geographical reach. Okay, what does this all have to do with food? You may or may not know about the Lone Star tick. This is a widely distributed tick that is actually quite aggressive and bites humans often. The nymph, the smaller tick in its lifestyle, and the adult females most frequently are the portion of the life cycle that bites the humans and spreads disease. And these are just the estimated distribution of this Lone Star tick across the continental United States. So again, what does this all have to do with food? This is really interesting. The Lone Star tick carries a sugar molecule called alpha-gal. So it's galactose alpha-1,3 galactose in its saliva. And when a tick bites a person, it can transmit this alpha-gal into the bloodstream. The body's immune system develops an allergic reaction to alpha-gal after this particular Lone Star tick bite. And people have a severe reaction. So they can get hives, that urticaria, that's just swelling, angioedema, swelling all across their body, abdominal pain, diarrhea, and nausea. And it's really interesting. And this is after they consume these mammalian-derived products, which cross-react with this alpha-gal. Sorry, I forgot to say that. So that includes meat and fat and other dairy products made from animals. It's actually quite prominent. So prominent that there was an article in the New York Times this summer talking about the whole island of Martha's Vineyard, not the whole island, but talking about restaurants and an increasing prevalence of people having alpha-gal and being unable to eat meat or dairy products, and how this phenomena has actually changed restaurants and food culture on Martha's Vineyards. And I thought just to show you how tiny these ticks are, this is a one of those hair remover thingies, and these are ticks that were on someone's clothing, but they're super duper tiny. So when you talk about tick-borne diseases, there's a lot of tick-borne health adaptations and resilience around doing things to protect yourself against getting bitten by ticks. But for the food systems and the health aspect, I will just point out from thinking about the Martha's Vineyard example and people not able to eat meat, that eating less meat is actually good for climate change mitigation. So we know that livestock emissions account for a quarter of total greenhouse gas emissions globally, and roughly 2/3 of those emissions come from cattle. So shifting from animal products to eating plants actually helps decrease the amount of methane that sticks around anywhere from 12 to 20 years. So methane's really low-hanging fruit in terms of mitigating the amount of greenhouse gases by individually eating less red meat. And this is compared to carbon dioxide, which sticks around a lot longer. So eating less meat and dairy and having fewer large ruminants around will help. Not that I'm advocating that having alpha-gal is good, but I just want to point out from a health standpoint and a health perspective that eating less red meat actually has enormous health benefits. So the evidence is very clear that red processed meat is linked to heart disease. This is the largest ever meta-analysis to date of 1.4 million people where they looked over a period of 30 years, and coronary heart disease is linked to processed and unprocessed meat. So decreasing red meat consumption is extremely beneficial for the planet, and it's also extremely beneficial for our patients. One more brief point about climate and health and food systems, and that's in the bucket of air pollution and increasing allergens. So as the world heats up, we trap more air pollution. Air pollution is closer to the ground. In Hawaii, we're concerned about our trade wind days decreasing. So that can concentrate pollution and allergens closer to humans. So what does that have to do with food? It turns out that increased ground ozone is a pollutant and is extremely bad for pollinator navigation. So this is a study looking at what happens. So as the temperature is warm up and this pollution is closer to the ground, these pollinators can't find and their ability to smell the floral odor and get to their food source is actually impaired. And this is just another study showing that compared to controls where there is no pollution exposure, diesel and ozone and the combination of those two actually reduces the number of pollinators and the number of flowers they visited. So that was a study population. Again, connecting this to health, research shows that the rapid decline of pollinators like bees and butterflies and other insects that feed on flowers around the world actually is causing serious decline in human health. So this is a study, again, a modeling study, looking at when we lose some of the insects that pollinate healthy foods like fruits and vegetables and nuts, you can actually project the number of human deaths from heart disease, stroke, and cancers. And you see also here on the x-axis, when you're looking at the projections among different countries, that the low middle, the upper middle, and the high income countries, that these affects upper middle and higher income countries as well. So some of the things that we can do about this is there's starting to be some public health campaigns, I'm sure you're aware of that, about pollinators, but again, linking pollinator health to human health can be very specific for linking climate change and air pollution and allergens and pollinators and health together. So we have seen how rising temperatures, increasing greenhouse gases, rising seas, and extreme weather causes impacts via heat and invasive vectors and severe weather, and that each of these in turn affect health, and how food is woven into each of these buckets to further amplify and multiply all of these threats from climate change. So how are we not all plunged into eco-anxiety or eco-grief, especially given the state of the world? I actually want to leave you with some good news, and I know a lot of you are working on this. And that is that climate change is solvable, and we know what to do. We have new technology. We also have long-standing indigenous practices to manage the land, stuff that we have touched on and that you all know much more about than I do. But I'm hopeful that with all of the work that everyone is doing, that we can really work on this problem. And one of the things that we try to do in the Climate Change and Health Working Group, this is the nonprofit that I started a few years ago with 2 other colleagues, is that really by attaching the health lens to the climate change fight, we're hoping that we can move the needle, because at the end of the day, we all care about our family, our friends, our neighbors, and it all comes down to health. That's what we really care about. So we do community education, we do listening sessions. We're also active at the state legislature, and we approach these solutions through the health lens. So for example, when government is debating a sewage infrastructure bill, for example, there'll be engineers and city planners that might show up. but we show up as nurses and public health students and physicians to bring that health aspect. So I wanted to leave you with a little bit of hope. And one of my favorite climate scientists, Katherine Hayhoe, you might know of her, she's always saying that the most important thing you can do is talk about climate change. And whatever you care about can be your starting point. So I know you care about food and I care about health. And I'm hoping we can overlay these interests more in the future to move the needle on climate. Thank you.
Wow, thank you so much, Dr. Kiefer. Whew, my head's spinning. That was a large body of information. So many things I wasn't aware of. Really interesting heat affecting the nutrient levels in crops. I didn't know that that was something that was actually studied and had data on. I was wondering if you know of any strategies that are understood right now to be like most effective for safeguarding nutrition in warming climates, what folks are doing on production levels, if that's something you've looked into.
Production levels in terms of agriculture and things like that.
Correct.
I'm less aware from the agriculture side. I will have to say that from the human health side and from the physician perspective, I think we're trained a little bit about micronutrients, but not as much as other health professionals like nutritionists. So from the health aspect of food and climate change, in terms of micronutrient deficiencies, we could probably do a better job in medical school to educate physicians on the connection between micronutrients and health. And also, we can do a better job of educating physicians on the connection between climate change and each of those buckets and health, and then health outcomes. I'm less aware, and probably people from your audience might know more about some of the stuff that is done in terms of research that is done in increasing nutrient density or preserving nutrient density in food. I don't know if
Sure.
anyone
Yeah,
from
and
the
it's
audience wants to weigh in on that.
yeah, no, I mean it's so hard to know every aspect of this too, I'm sure. And you have so much, so many specific things you're working on. I'm just curious, like through Hawaii Climate Change Health Working Group, has there been any discussion on how food security and nutrition be integrated into emergency preparedness planning? Um, like, stocking, like you're mentioning a lot, culturally appropriate foods. Is there any connection, any discussion around that taking place at the state level?
Um, I'm not really aware of that. We are just starting to dip our toe into food security and some of these emergency management. So we're a group of volunteer physicians and public health people and nurses, and one of our jobs is to break down, or goals is to break down the silos like you that exist between all of these connections. So as emergency preparedness becomes more talked about. It's definitely in the news lately. We've had so many near misses, and then with everything that happened in Lahaina and the tsunami warnings, I think people are starting to become more aware, and issues are, we're starting to coalesce on this, but we are just at the beginning stages. So we would love any help and collaboration to see what we can do to specifically bring the health angle to this topic. And then also physicians too can do a better job of making their patients aware of needing 2 weeks supply of medicine, but also food, and talking about trying to choose food that can be better for their health. So some of those low salt canned vegetables, grains, things like that, ready-made food, but healthier versions.
Sure. Yeah. And as we're winding down, I posted in the chat Hawaii Climate Change and Health Working Group. Folks can log in there and sign up and get more info. And really just wanted to mahalo you once again for taking the time, for putting this beautiful presentation together. Thank you to everyone who attended today. Really appreciate everybody's support. And yeah, mahalo. Hope everyone has a nice day.
Thank you so much for having me. Thanks.
Aloha. Mahalo.